Want to know what's going on with telehealth and whether it will even be here at the end of this month going into April? Also, how are all these executive orders affecting us, the patients, as well as the medical providers who take care of us? And lastly, a major insurance company makes a major pivot in terms of their prior authorization processes. Guys, buckle up. We have a lot of ground to cover. You are tuned in to our RCM Roundup. Let's go. Hey y'all, what's up? Tiffany Robinson here from Beyond RCM, Revenue Cycle Management here in the state of New York, and we have a lot of ground to cover. Now, first of all, I'm always excited to see you guys. I'm always excited to engage with our valued subscribers who tune in to get up-to-date content related to the healthcare industry. But I also want to welcome anyone who's joining us for the first time, and I want to encourage you to like, subscribe, and hit the notification bell, because Beyond RCM YouTube channel is a YouTube channel that is designed for not only healthcare professionals, but we also provide a lot of useful information for healthcare consumers, you, the patients. So if you want to learn more about healthcare as it relates to getting into this industry, or you just want some clarification regarding evolving topics in the news, then like, subscribe, and hit the notification bell, because this is the place you want to be. So I'm going to jump right into it because we have a lot of ground to cover. I'm going to be looking down at my notes because I have a lot of notes. There is much to talk about. And the first thing I want to talk about is what is going on with telehealth, right? So telehealth is set to potentially end at the end of this month. And by end, what I mean is it's going to revert back to its original iteration prior to the COVID-19 public health crisis. So prior to COVID-19 and us going into a public health emergency, telehealth was really only offered to individuals who were living in rural areas in the country. They didn't have the access to care as more populated areas. And in these rural areas, in many instances, they had to obtain those services through like a satellite clinic or satellite location. Once the pandemic came into play, the issue became social distancing and making sure that patients were not showing up in droves at medical practices and hospitals and potentially spreading the COVID-19 virus. So what our government did at the time was they relaxed a lot of the requirements concerning telehealth, and they allowed pretty much all Medicare recipients to be able to receive telehealth services in the comfort of their homes. This allowed patients who did not have life-threatening conditions, but conditions that required monitoring, to still get access to their medical providers. And it also allowed medical providers to be able to treat their patients. And as you can imagine, getting Medicare patients to even adopt a telehealth workflow was not an easy thing to do. Many patients didn't feel comfortable using audio video platforms like Zoom and other platforms to have their doctor's visits. And Medicare even had to go as far as allowing Medicare recipients to be able to see their providers on the telephone only, and providers were essentially able to still bill for their regular E&M visits, even if the visit was virtual or by telephone. So basically, a lot of the restrictions that were on telehealth prior to the pandemic got very relaxed during the public health emergency. So what we're looking at the end of this month is we're looking at potentially those type of scenarios for patients being seen pretty much coming to an end. Now, we know that the public health emergency officially ended in May 2023, but what was extended was certain provisions, and there was a specific act that was passed by Congress called the Consolidated Appropriations Act, which allowed telehealth services to remain in place through the end of December 2024. So basically what Congress said is, although we are officially ending the public health emergency, we are going to keep telehealth services as is until the end of December 2024. And hopefully we can sort it out and figure out what we're going to do from here. Well, 12/31/2024 came and went. Congress and, they was fighting over their budget, and I guess they decided, look, we're not going to deal with this right now. We're just going to kick this out until the end of March 2025. And that is how you got an extension of telehealth services from the original December 31st deadline to now the end of March. Now, if you go searching online to find out if telehealth is officially coming to an end, you are not going to see any language that steers you in one direction or the other. And that is very frustrating on the provider side, because providers are setting up their schedules to accommodate their patients. They have certain patients that they're seeing virtually. They're having certain patients that they're seeing in the office, and they have to figure out, well, what are we doing? Are we going to continue business as usual, or are we just going to discontinue telehealth services as of April 1st? And then, of course, you have the patient population. And when you look at a population such as our elderly population tends to be very set in their ways, and they are not creatures of change. So now we're potentially having to talk about undoing certain things that they've become familiar and comfortable with as it relates to telehealth, and now saying, well, nope, you're not going to be able to do this as of April 1st. You're going to have to go back into your physician's office. So it's also about, helping our elderly population readjust. I was talking to someone on LinkedIn several weeks ago when we originally started discussing the fact that telehealth might be coming to an end. And she stressed a lot of concern for her mother who deals with dementia. Telehealth was a major convenience for her because it was easier to make sure that her mom got access to the care that she needs. And her concern is now, how am I going to navigate getting my mom back to her appointments now that the service is coming to an end? So it's a lot of chaos. And I'm sure many clinicians watching this video is like, okay, Tiff, what should we do, as many patients are? And what I would recommend to my colleagues and medical providers in the medical community is, I would recommend that you prepare as though telehealth is set to come to an end at the end of this month. I would keep your telehealth services on the schedule through the end of March, and then I would prepare as though as of April 1st, this is not something that's going to be covered by our government, and we're going to have to pivot the patients back in the office. Some providers may not want to do that. They may want to wait and see because they don't want to inconvenience their patients. Obviously, that is your prerogative. But ultimately, if the services do come to an end and you continue to see telehealth patients into April and beyond, those services would essentially not be considered reimbursable services by CMS. So that's just something to keep in mind. And that brings me to an important point on the patient side. Patients, you may be wondering, well, what should I do? I have a telehealth appointment scheduled in May or in April or in June. Should I still keep that appointment? I would recommend that you reach out to your medical providers and just say, look, I'm hearing that telehealth is supposed to come to an end. Should I change my appointment from a virtual to an in-person visit? And have your medical provider's office direct you on the best course of action. One thing I do want to say is to our patient watchers, if your medical provider ultimately tells you, don't worry about it, keep your virtual visit, and telehealth comes to an end as of April 1st, you should not be responsible for those bills, because it's up to the medical provider to know that these services are coming to an end. And if they're still going to take the risk and bring you into the office, if they're still going to take the risk and see you virtually, if they ultimately do not get paid because telehealth is no longer covered, they cannot in all good conscience pass that cost on to you. So just want to give you a little heads up on that. So the moral of the story is telehealth coming to an end at the end of the month? I don't know. We are gonna have to watch and be prepared. Hope for the best, prepare for the worst. Okay. All right. So the next topic I want to talk about is UnitedHealthcare. Now, UnitedHealthcare has had some not great press in recent months, as we know. Unfortunately, their CEO, Mr. Brian Thompson, was murdered at the end of the year, and that shocked the healthcare community. But UnitedHealthcare is making some positive impacts as it relates to their prior authorization process. UnitedHealthcare announced that as of April 1st, 2025, for their Medicare Advantage and their S&P programs, they will no longer require prior authorization or concurrent review for home health aid services in many of the states that they operate in. Now, as you know, many of the larger insurance companies and even some of the smaller ones have come under fire in recent years because of their very long, drawn-out, complicated prior authorization processes. We've heard countless stories of individuals battling life-threatening conditions, needing access to care, and not being able to get the access to the care that they need because of the prior authorization process. UnitedHealthcare has signaled even prior to the tragic events surrounding their CEO that they wanted to look at the prior authorization process and look at ways where they could make it an easier process for their patients and for medical providers. And they are making good on that promise by eliminating the prior authorization process for home health aid services, for particularly Medicare Advantage and dual special needs plans. There are some plans, there are certain states that do not fall under this new April 1st criteria. And what I'm going to do is I'm going to put a link to the article where UnitedHealthcare goes over which states will be covered versus which states will not be covered. But the good news is that they are eliminating this in more states versus not covering it in less states. So again, I'm going to drop the link in the description. You can check it out. And I just want to say, side note, I'm going to go off on a little bit of a tangent here because, you know, I do work as an RCM director. I really hope that Cigna and their baby Evercore are taking notes, because your prior authorization processes are legendary at best and shameful at worst. You guys act like you don't know each other. You guys act like you're two different companies and, you know, we don't know each other. When if you dig beneath the surface, Evercore is owned by Cigna. And I just hope that Cigna and Evercore will look at ways to just do better, you know, do better. I hear horror stories from many of my colleagues in the industry that struggle to get prior authorization requests. You know, they send their information to Evercore. Evercore approves the information. Their claims then get denied by Cigna because, according to Cigna, Evercore never sent them the information, the authorization number in their system. I have providers who I am colleagues with in the industry that have gotten prior authorizations for years from Evercore. Now all of a sudden they're not in the system anymore, and they have to go back and forth to get their providers reloaded back into the system so they can get them prior authorized by Cigna. It's just not cool. Y'all know each other. This is not Mariah Carey and J-Lo. I don't know her. Y'all know each other, and you guys need to take a page out of UnitedHealthcare's book and do better. And I'm just going to leave it at that. Okay, moving on. So there was an interesting article that came out, and you know, I am very challenged at this point in healthcare because... Hey, what's up? Just stopping by really quick to make a quick ask. We've been reviewing our data analytics, and we've noticed that we have tons of new individuals checking out our channel, which is geared towards all things healthcare. However, many of our viewers are not subscribed to our channel. Subscribing to our channel allows our content to go into the proper algorithms so that we can spread knowledge related to the healthcare industry to all those who are interested or looking for guidance. So can you do me a favor? If you haven't done so already, can you please like, subscribe, and hit the notification bell? That allows our information to get into the hands of those who truly need it. Thank you so much for helping us out in this way. Let's continue being great together. But I have to make sure that when I put out content on this channel, I'm putting out content that is not biased and that is giving our viewers a very fair and balanced information so that they feel empowered to make whatever decisions that they need to make as it relates to their careers, as it relates to decisions regarding their healthcare. So, you know, I have to pray real hard anytime I talk about any decisions that come out from our current Administration, because again, I don't want it to get too, and I'm gonna leave it at that. So Healthcare Dive put out a really great article, and the article is called The Top 3 Impacts of President Trump's Health Data Purge. So again, it's called The Top 3 Impacts of, well, it says Trump's Health Data Purge, but he is the president, so President Trump's Health Data Purge. So the first thing I want to say is executive orders are not actual laws. I mean, our president has the right to issue executive orders, but it's not a final law. So when you see things like executive order for this, executive order for that, I just want to tell you, please don't go crazy over it. It's not the final say. Okay, and I'm going to move into the story. So an executive order was issued earlier in the month of February, and basically organizations like the CDC, Center for Disease Control, the FDA, the Food and Drug Administration, and HHS, Human and Health Services, they had to scrub data off of their website that had anything to do with sex, gender, diversity, equity, and inclusion, and foreign aid. So the executive order was, if it had anything to do with any of these topics, it had to come off of the sites immediately. So of course, these organizations wanting to comply with the executive order removed a lot of this information immediately off of their systems. Now, immediately after these executive orders were issued, there was a lawsuit filed by Doctors of America, and ultimately a judge ruled, because again, executive orders are not final laws. Okay, they're not the law of the land. A judge ordered that certain data points had to be placed back on each of these organization websites. And, I want to just take a moment to highlight the importance of public health in the United States of America. And I know a lot of people don't study public health unless you went to school to get some type of degree or certification in the healthcare space. You likely have limited knowledge about the important role that public health plays in our country. So as someone who has gone to school and has completed countless papers and coursework on the healthcare industry and public health, I just wanted to take a moment to just give a simple summary of why public health is so important in our country. So when you look back 100 years ago in the United States of America, the average life expectancy for men was 56 years old and women 58 years old. So that meant 100 years ago, most of the population would not have even lived long enough to even collect a Social Security check. Okay, and many of the reasons that our American population was not living longer was because of public health issues. So things such as people dying from the flu, people dying from pneumonia, people dying from tuberculosis, things such as lack of sanitation and not having clean drinking water. So when you go into urban areas, you're talking about waste being thrown out the window and thrown into the sewage, and not having a proper filtration system to clean our water. Things such as babies and children, babies not living to term to be birthed into this world, and then children dying of some of the diseases that I just mentioned. When you look at a state like Texas, where they have a current measles outbreak, when we've had a measles vaccine since the 60s that has worked quite effectively, I think that tells you all that you need to know about public health. When our own current HHS secretary, Mr. Robert F. Kennedy, a very outspoken anti-vaxxer, is now saying that we should get our kids vaccinated, against measles because of the outbreak in Texas. I think it's incumbent on us when we talk about public health that we really do our own research and use wisdom. I'm grateful. I really wanted to, I had to pull this book out of the archives. I studied this entire book during my undergrad, and it's called At Risk in America. And this book taught me things about public health that I would have never known if I didn't take this course and really delve into the importance that public health plays in our country. Today, as it stands, the average man in our country is living to the age of 76 and the average woman to 78. So we have increased life expectancy by 20 years just on the strength of our public health efforts. And organizations like the CDC, they track diseases from different areas, not just here in the United States, but also globally. Organizations like the World Health Organization, they track disease and mortality globally. When the pandemic occurred, it didn't start, the COVID-19 pandemic I'm talking about, it didn't start in the United States of America. By all research and accounts, it started in China, and obviously it ended up here in the United States of America. So what happens in other countries, from a public health standpoint, it does affect us eventually. So I think that we really need to educate. I would implore any of my viewers to please educate yourself on the work that these companies are doing, these organizations are doing, because a lot of the work that they're doing is why we are living longer, we are living healthier, our children are able to grow up and not have to deal with things such as polio or other things that can have lifelong repercussions if they catch it and they don't have the proper treatment during their childhood. So I think it's important, and I want to say kudos to those who are doing the work and still getting the message out there. But public health is important. Public health is definitely important. I'm not going to touch all the other things that were mentioned in terms of what had to come off of the websites. But I do think that it is important for us to understand that there is value in protecting public health, and the health of the public affects all of us. And I think I'm gonna park my RCM Roundup there. Public health is important to all of us. I want to thank you so much for taking the time to hang out with me today for this RCM Roundup. Again, if you haven't subscribed to our channel yet, I want you to like, subscribe, and hit the notification bell. I'm gonna put links, receipts, honey, to every topic that I discussed in today's roundup. So I will share links on what we know so far as it relates to telehealth, which is, I don't know, but I am gonna still share some links. I'm also gonna share the information on UnitedHealthcare relaxing their prior authorization policies. You wanna check that link out to see if your state is one of the states that will not be included in that April 1st update. And I'm also gonna share some links on public health and the importance of public health and how our country has benefited from public health. I want to thank you so much for taking the time to hang out with me today. My name is Tiffany Robinson, aka Coach Tiff, and I will see you guys in the next video. Take care and God bless. Peace out.